Okay.
So if you've read and understood considering its surgical pathology station, please tell me what is the signet cell carcinoma?
Signet cell carcinoma is a type of gastric cancer, carcinoma,
Yes.
diffuse gastric cancer,
Yes. Okay.
and with a worst prognosis.
Right. What is the pathogenesis behind gastric carcinoma?
It could be sporadic or it is hereditary.
Okay. And tell me the sequence of events, how the pathology occurs from normal mucosa. There is irritation, leads to chronic gastritis, then metaplasia, dysplasia.
Metaplasia.
Okay, so all this you have to tell me until invasive gastric carcinoma. Okay. Right. Tell me what is the most common type of gastric carcinoma?
Adenocarcinoma of the gastric, of the stomach.
What is the classification system which is used for gastric carcinoma?
TNM calcification
And
the Duke calcification.
and
TNM
what,
and Duke calcification.
okay, what is Borman's classification?
I didn't know this classification.
Okay. What do you understand by linitis plastica? All right.
Oh.
Okay. What are the investigations that you would do to confirm gastric carcinoma?
Taking biopsy, upper endoscopy, and taking a biopsy from stomach wall.
Yes,
and the genetic study.
Okay, what are the genes which are involved in gastric carcinoma?
Hereditary diffuse gastric carcinoma, HDC1.
Okay, and
like this.
Okay, what are the risk factors which lead to formation of gastric carcinoma?
It could be hereditary, or it could be the smoking, alcohol, also south east of the Asia, and some family, Morey family.
Okay.
Yeah.
Right. Please tell me what is virtuous node?
What is the what?
Virtuous node. Virtuous node.
Versus node?
Yes.
I don't know what's this.
Left supraclavicular fossa, lymph node, anything.
Vercus node.
Yes.
Right?
Yes.
Yeah. And the left supraclavicular node.
Why?
Vercus node. Yeah.
What is it?
It is lymphatic drainage for the lower esophagus and stomach.
Yes, but you have to give me a little bit more explanation for me to understand. Okay, there is another sign, Treasure sign. What that is? What is Crookenberry tumor?
Wow, Mama,
All
I
right.
think.
Okay. Please tell me the prognosis, the overall prognosis for gastric carcinoma.
Signet cell is the worst
Yes,
prognosis. Yeah.
The 5-year survival rate is only 10%.
Okay.
All right. What other paraneoplastic conditions are associated with gastric carcinoma?
Paraneoplastic.
What other paraneoplastic conditions are associated with gastric carcinoma? So if you've heard of acanthosis nigricans and dermatomyositis. Right. Okay. What treatment can you suggest for a patient suffering from gastric carcinoma? Yes. Treatment.
What?
What treatment? Yes.
by multidisciplinary team.
Yes.
It could be surgical Rux NY, I think. Well, no, McQueen surgery. I don't know actually this
Okay,
one.
we'll come back to that
It's
later.
totally different than what's written to me.
Okay, if you could help me and read this, would you be able to, please?
This is looking
What are these cells?
glandular tissue
Yes,
with
but
hyperchromatic nuclei, large nuclei, decreased nucleic cytoplasmic ratio,
yes, and
with high mitotic figure.
yes,
Also, uh, with the infiltration outside of the basement membrane.
yes, and okay,
Uh,
please tell me what you understand by the term dumping syndrome.
Dumping syndrome, it is a syndrome that occur after removal of a part of the
You
of the
don't
large
use,
intestine.
yes, you
Yeah,
don't use the word syndrome. You say it's a condition which results.
it's a condition.
But what happens in it?
After feeding, there is a rush of insulin that lead to episode of hypoglycemia, and maybe it lead to deterioration in conscious level of the patient.
What is difference between early dumping and late dumping, please?
Early dumping is hyperglycemic condition, and late dumping is hypoglycemic.
And it starts in between 30 to 60 minutes.
Yeah.
Yes, followed rapid meal.
Yeah, and also, it is due to hypoglycemic and some electrolyte disturbance.
Okay. Right. How would you, all right, okay. What are the what are the complications which are associated with total gastrectomy? Early and late,
Okay.
if you can classify and tell me like this, please.
Dumping syndrome. It also early. It also leakage of the after anastomosis.
Yes.
Also, it could lead to macrocytic anemia.
Uh,
Also, vitamin
it's
deficiency.
not early microcytic anemia.
Uh,
The early could be, okay,
Early, it could be
anastomotic hemorrhage, infection.
anastomotic hemorrhage, infection, DVT.
Oh, DVT. Okay.
Yeah, from the
Pancreatitis.
complication of
Okay.
pancreas.
But then late would be, okay, anemia, dumping syndrome, metabolic bone disease, recurrence of malignancy, etc.
Okay.
So good. Thank you.